Hi, how are you? I'm good. Should I ask you something? Sure. I know you have diabetes, but still, you live such a productive and active life. What is the secret? Yes, you're right. Do you want to know the secret? The secret is my knowledge about diabetes and its management.
Yes, knowing more about diabetes is the only key. And you know, Sweet Talk is the program where you can get all important information about diabetes.
Sweet Talk.
Yes, Sweet Talk. Under this program, Dr. Tom Babu, a leading diabetologist, is going to appear on TV to have a small chat with us about living with diabetes.
Is it? Let me go and watch Sweet Talk and get information about diabetes.
Namaskaram. Welcome to Sweet Talk. I'm Dr. Tom Babu. I'm the consultant endocrinologist and diabetologist here at Silver Line Hospital, Kadavantara, Kochi. This video is mainly to educate and clarify doubts and help people understand what diabetes is all about, both in terms of managing diabetes, treating diabetes, and overall control of diabetes. Okay.
Doctor, what is diabetes?
Diabetes is a state whereby the insulin production in the pancreas does not come up to optimal levels, or in other words, there is a mild to moderate or severe dysfunction of the pancreas in producing insulin, and thereby a patient becomes diabetic. Now, what happens is that insulin is the key to help people use a much wanted fuel, which is glucose. And when you have deficiency of insulin, the glucose is not able to get into the so many cells in our body, and therefore it leads to this state called diabetes.
Doctor, who are at high risk of getting diabetes?
Patients at high risk of diabetes would be: 1, people who are obese; 2, who have a very strong family history of diabetes, which is either father, mother, brother, sisters, uncles, aunties having a history of diabetes, at a very high risk of developing diabetes in future; people who already have hypertension, dyslipidemia, coronary artery disease, strokes. These people are also at very high risk of already having diabetes or developing diabetes in future. Women who were known to have gestational diabetes in the past, in the previous pregnancies, are also at very high risk of developing diabetes in future.
Doctor, are there any types of diabetes?
So basically, if you look at the type of diabetes, the most common form is called type 2 diabetes. Now, this is what we see normally in our practice. About 95% of people who come to us have type 2 diabetes. Now, type 2 diabetes is nothing but a form of diabetes which can be treated with oral drugs in the beginning, and maybe then later on these patients may or may not need insulin. Then coming to a slightly rarer variety. So I said 95% is type 2. About 5% we see type 1. Now, type 1 is otherwise called juvenile diabetes, where it's mostly seen in children. There can be 2 age groups. One is between 4 to 6, or then later between 14 to 15 is the age groups when these children actually come to us. And also, rarely, some adults also can develop this form of type 1 diabetes. That is, basically these adults are between the ages of 29 to 35, and they also become acutely insulin requiring. So in other words, to put it simply, these patients with type 1 diabetes, be it children or be it adults, they absolutely require insulin for sustenance.
Doctor, are there any signs and symptoms of diabetes?
Yeah. So basically, when the blood sugars go very high in a diabetic, sometimes they come to us at the first instance itself with very high blood sugars. Then how they come to us is they usually come with intense thirst, increased frequency of micturition, loss of weight, recurrent skin infections, sometimes infections at the tip of the penis in case of men, in women, itching over the private parts and all that. So these are some of the manifestations with which they come to us. But often you must understand that diabetes is generally considered as a silent disease or a lifestyle disease. So often you will not have these hardcore symptoms to actually understand that somebody is suffering from diabetes, and usually it's picked up during routine screening for the disease. It may be in hospitalized patients, they get admitted for something, so we do a routine blood check, one of which would be blood sugars, and then we pick these patients up. Or otherwise during camps, during mass screening programs, or during tests that people have to go as a pre-medical evaluation for a job, etc. So these are the instances when people get picked up, and then we get to know, and then we start treating them. So the short point here is that diabetes can be largely asymptomatic, and it is for us to understand who is at risk for diabetes and who should get checked for diabetes, and the diabetes should be picked up early and treated intensively.
It is said that various body organs will be affected by diabetes. Is it true, doctor?
Certainly, diabetes is also otherwise called a silent killer. Now, why it is rightfully called that, the reason being diabetes can affect almost every organ in the body. Now, if you start from the top, it can affect the eyes, it can affect the heart, it can affect the kidneys, it can affect the nervous system, it can affect the blood flow to the lower limbs, etc. So you can imagine that it can affect almost every part of the body. So it is important to prevent the secondary complications or the complications that arise out of diabetes. So it is important to understand that these are the many problems that a diabetic can have, and it is also important to understand that to a large extent these things can be preventable if dealt with appropriately. At a very early stage in the disease, if these things can be treated appropriately, we can actually do a lot to prevent long-term complications. But otherwise, once these long-term complications happen, then there's very little that we can do about it. Say, for example, somebody has a heart attack, somebody has a stroke, or somebody has a non-healing ulcer over the foot. By then it is a late stage, and there is very little anybody can do anything about it. So the whole point is we need to do everything to prevent the complications that arise out of diabetes. So how do you do this? You be aware, be educated. So programs like the Sweet Talk that we're just doing today is in pursuit of trying to prevent or save diabetic patients from these deadly end organ complications.
Doctor, is diabetes curable?
No. Diabetes is basically a state, is a disease, and we cannot cure it, but we can effectively manage it. So it is wrong to think at any point, in a diabetic's life, that we can completely do away with the disease, and maybe stop pills, maybe stop insulin, and there are dime a dozen people from all walks of life trying to tell you that no, you come to me, I'll cure you with maybe some a drink that you take, or some leaves that you consume, or any of these things, and tell you that we can cure the disease for you. But it's really foolish to think that diabetes can be cured. But the good news is that diabetes can be managed through effective understanding of the disease process, a good engagement and consultation with the healthcare people, that is doctors, diabetes nurse educators, nutritionists, physiotherapists, the entire team, podiatrists, etc., who make up the team to treat diabetic patients. So basically, we should be in close engagement with these people, so that we ensure that the diabetic patients have a long and healthy life. If not, it is going to be doomsday. There is going to be a lot of problems that a lot of diabetic patients can get into if you choose not to take it seriously.
Doctor, how can we control diabetes?
Most important is education or understanding the disease. So you need to get as close as possible to the disease as you can. So thereby you insulate yourself from a lot of wrong concepts, misconceptions, misunderstandings, myths, etc., which can get diabetic patients into a lot of trouble. So it's first of all important to understand this from the doctor's office, or the doctors, in the diabetology department should, that at every level, make it a point to educate diabetic patients about the disease and about the implications. So the best bet is to understand or come close to the disease as possible. And then what then inherently happens is that if the patients understand the importance of taking pills on time, not missing the pills at all, routinely checking bloods, and also looking for the end organ complications like retinopathy, cardiac problems, nephropathy, the peripheral vascular disease, neuropathy, etc., routinely, because that is what the endocrinologist's office or the team, the diabetology team, will do for a diabetic patient. So it's important to closely align yourself to this whole process. So the doctor and his team will make sure that you're safe and you live a long and healthy life. And also, the last part of it is the treatment. Treatment needs to be taken very seriously, and automatically when you engage your doctor and that doctor's team very efficiently, then they will make you understand the importance of taking medicines on time and not missing the medicines, even if it's insulin, taking the insulin on time, the right technique, what you have to do to make sure that you don't fall ill, that a lot of people will go through when they take insulins and all that. So how to avoid these problems and so forth. All these things will be nicely told to you by the doctor and his team.
What are lifestyle changes?
See, basically, understanding of the disease will automatically will make you change your lifestyle. That is, for example, if you're leading a unhealthy lifestyle, which I would think is not exercising enough, eating junk food, eating carb-rich food, eating more fries, and so on and so forth. So if that's what you're already doing, then chances are that when you understand the disease, you'll realize that you need to be more physically active, you need to shed weight, you need to be very choosy about the foods that you eat, etc. So automatically, as I am always reiterating here, that education or awareness of the disease is very critical to keep this at bay, to help you control the diabetes as well as to prevent complications. So that is what we need to do. So there will be lifestyle adjustments, but these are not big adjustments. I mean, I don't think a patient should be worried that he has diabetes, so his life is going to turn around, is going to turn on its head, etc. But these are unwarranted. Basically, these are very small adjustments that one needs to make to incorporate these healthy lifestyles into somebody's already existing lifestyle. So it's not a great deal, but it is important nevertheless.
Doctor, tell us more about diet control. What can be eaten? What should be avoided in diabetes?
Everything in moderation is what I would recommend very strongly, because there's nothing that I would say don't eat, or there's nothing that I'll say eat bucket loads or truckloads. It's not like that. Everything, whatever it is, if you can take it in moderation, that is the key. Now, having said that, you can always choose from the more healthier forms of foods. For example, cereals. You can, when you look at cereals, it's always good to go for whole grain cereals. Say, for example, what you mean by the whole grain means that the whatever grain you're talking about, be it rice, be it wheat, be it maida, be it the dal, be it any one of these things, you should look for these things which have a coating to it. Say, for example, rice. If you were to choose, you should choose the brown rice. So the more brown it is, the better. So like that, the wheat, like that, the maida, like that, the rava. All these things, if you can choose the whole grain instead of the polished variety of these things, it's always better. So for example, let me give you a small example in this context. So if you are given chapati versus your Kerala paratha, it's always better to take the chapati, because chapati contains wheat, and wheat is a whole grain cereal, whereas the paratha contains maida. Maida is a polished form of wheat. So the good part of the wheat has been kind of polished off. So the chances that the blood sugars shoot up, to very high levels is always going to be there if you're going to, treat yourself to the paratha. So it's always good to stick to chapatis. Like that, if you can make healthy choices in your diet, it'll always be helpful. And it's important to consult a good nutritionist, and usually in Silverline we have an excellent nutritionist department or a nutrition department, and the nutritionist is always there round the clock to help patients understand the nuances or the complexity or the nitty-gritties of the diet. So ideally, a diabetes team will comprise of a very good nutritionist also. So the nutritionist will be there to make sense out of these questions in terms of diet, and often there are dime a dozen questions arising in people's mind, and rightfully so. They should be clarified, and the nutritionist will help you with that.
Doctor, thanks for sharing information about food. Please tell us about exercise.
Yeah, exercise also in moderation is what I would recommend, because it's wrong to blindly tell every patient exercise. It is good, but then you should consult your doctor in terms of what form of exercise may be best for you, because some patients who are severely neuropathic, we advise them not to walk too much. We ask them to do upper body exercises. So like that, or people with already an existing heart problem, we need to advise them to exercise very judiciously, because just if while exercising they develop a chest pain or chest discomfort, then this has to be explained to the patient, and then they should immediately stop exercising and take rest, and maybe even bring this up to the doctor's notice when they are visiting the doctor next, or immediately visit the doctor if in case there was a discomfort while exercising. So basically there is no one size fits all. Exercise is important, but it has to be individualized. So every patient, every diabetic patient should consult the doctor, and also usually we have a physiotherapist as a part of our team. In Silverline we have a very good physiotherapy department, and the physiotherapist always advises or educates each diabetic who comes to Silverline as to what the scale of his exercise should be, what is safe for him, what is not safe for him, etc. And that's how it should be done.
Doctor, I don't get time to exercise. Is it important to exercise for a diabetic person?
No, I don't think that's a good thing. Often we are, beset with or faced with this sort of an approach, and I mean, it's sad that people think that way, because then they don't. It means that we have not made them understand the importance of exercise. I mean, when somebody says this, it is for our medical team or the diabetes team to engage these people a little more closely and convince them that that is, certainly a wrong way to think, and impress upon them the importance of exercise.
How much should be the blood sugar level? Once in how many days a blood test should be done?
It depends. If this diabetic patient is on oral hypoglycemic agents, then he just needs to test his blood sugars maybe once in 45 days. So he can, we advise patients on oral medication to come to us once in 45 days, get the blood sugars tested in the lab, in the hospital, and then we adjust medications accordingly and we send them. But the story is different with patients on insulin, because patients on insulin need to monitor blood sugars on daily basis, and again it depends on what regimen the patient is on. Because for example, if the patient is on once daily insulin taken at night, then we ask them to do morning blood sugars, and that too on alternate days. But if somebody is on twice daily or more frequently, then we ask them to do on daily basis, sometimes twice daily. So and also in this regard, a diabetes nurse educator is very important, or his or her role is very critical in terms of emphasizing how often the blood sugars needs to be done, and how to kind of record it on a logbook, and how important those recordings are in terms of how a doctor and his team decides on how the treatment has to be modified, how it has to be affected. All these things depend a lot on this logbook that the patient brings. So it depends on what regimen the patient is. It varies from regimen to regimen. So that's how it is.
Doctor, can I check my blood sugar with glucometer at home, or I have to go to lab every time for test?
Like I said, glucometer testing for patients on insulin, we call it self-monitoring of blood glucose, or otherwise SMBG. That's very important in patients who are taking insulin, sometimes once, sometimes twice, or more complex regimens. Now, for those people who are taking oral hypoglycemic agents, then also it's important to have a glucometer at home, because then what happens is, for example, sometimes the blood sugar slips low, sometimes it slips precipitously low. We call it hypoglycemic attacks. Now, during this time, in order to recognize a hypoglycemic attack, then at that point the blood home monitoring meter or a glucometer helps to find out if the patient is feeling sick because the blood sugars have dipped very low. But otherwise, generally, like I said, for patients on oral drugs, do not need to test blood sugars at home. So they can come and get a venous sample done. Whereas people on insulin, it is very important to monitor blood sugars at home. And the doctor and his team would have generally told them how it has to be done. But yes, to answer your question very squarely, home monitoring is very important. It's not diabetic is not only at risk for just the complications that arise out of diabetes, but also because of lipid abnormalities, also because of the complications that arise out of diabetes. And the only way that we can pick all these things out are by doing small tests, which will actually help us to screen all these organs that can be affected by diabetes. So two things to remember. One is that usually when you have diabetes, you have cholesterol problems also associated. You have so it is important to test for cholesterol in every diabetic. And also, over and above that, now these diabetic patients, like I told you earlier, the other organs can be affected, or there can be several organs that can be affected. So in order to screen for these organs, we need to test, or we need to do small tests. For example, renal function tests to look at the kidney status. To rule out nephropathy, we do a urine microalbuminuria or albumin creatinine ratio. So small tests will let us know if the diabetes has started affecting the kidneys. So like that, then for example, liver function test. Why do we do a liver function test? Because diabetic patients are prone to have fatty liver. So we do a liver function test to ascertain whether the liver has been affected or if there is a danger from that area. So then we do a complete blood count, usually to look at the hemoglobin status, because sometimes diabetic patients who develop renal failure, the hemoglobins will go down. So like that, we do a battery of tests just to cover each of these organs.
What is HbA1c, doctor?
HbA1c, or it's otherwise called glycosylated hemoglobin A1c, is an important test, and we need to do it at least once in 3 months. It depends on for example, in Silverline Hospital, we make it a point to test A1Cs once in 3 months, because it gives us a solid cue, or it gives us a solid direction in terms of the treatment that we need to offer to the patient, and also in terms of how often the patient needs to follow up. And it gives us, in a sense, in short, it tells us overall the performance of the patient in terms of how effective the blood sugar control has been. Yes, A1C is a very important tool, and it has to be done once in 3 months, at least once in 6 months.
Doctor, if I continue to take this medicine lifelong, is there any side effects of it?
Definitely. So medicines, like I said, there is no cure for diabetes. It can only be managed. So from that point of view, medicines definitely need to be there, but it's just that the quantum of medicines will vary from time to time, because initially we'll start with very basic medicines. Then as we go along in time, we have to intensify, and there may be a point in time that we need to move on to insulin also. So it depends. I mean, it is highly individualistic. There is no definite way of saying which patient would require what. So it has to be a strictly doctor's prerogative in terms of what the patient really requires, and at what level of diabetes he is going through, and the optimum treatment modalities.
Doctor, I take my medicines regularly, and now my sugar level is under control. Can I stop my medicine?
Definitely not. See, the fact that it is being under control is because you're taking medication. If you hadn't taken the medication, the blood sugars or the entire lab reports are going to look very bad, or it's going to be haywire. So just remember, like I said, there is no cure for diabetes. There is only effective management, which means that you have to take the prescribed pills. There's no way you can stop it. And you need to, just consult your doctor at every point, talk to him freely, take his advice, and just keep it.
Doctor, what are your views about herbal medications in diabetes management?
See, basically, I think that opting for alternative forms of medicine, where we don't have enough evidence to suggest that, whatever somebody is claiming is actually true or not, would be actually subjecting yourself or your body to an experiment. Whereas in allopathy or modern medicine, all these medicines are proven and approved by very highly respected bodies, and only then it is out there in the open market. So therefore, all these things have been analyzed and endorsed by very senior doctors and scientists. So these are bound to be very safe. Whereas alternative forms, it is, they crop up or they are fly-by-night kind of a situation where one day it's there, next day it's gone. So I would consider it very unsafe to venture into these sort of practices. So I think let's stick with time-tested approaches, which is modern medicine, and I think you're safest doing that.
Doctor, in case of fever, cold, vomit, diarrhea, etc., can I stop my medication?
No, you should never skip medicines or insulin when you feel sick or you have diarrhea or vomiting. And ideally, you should, when you are faced with these situations, you should go and consult your doctor, because then the doctor would reassure you and tell you what you have to do. The best thing to do in these situations, like for example you're vomiting, you have fever, you have diarrhea, would be to continue taking the medicines, but take food along with it. Never stop just because you're vomiting, and that you don't take food for like hours together, but then you take the tablet also. It shouldn't be like that. It should be that you take your medicines, but you should take your food also. Even if you vomit, that's okay. Let the food be thrown up. That's okay, and we can deal with it. But not taking medicines, and skipping food in these situations is very unwise. And this applies more to juvenile diabetic patients who are on insulin, and they definitely cannot skip their insulins, because it can sometimes land up in life-threatening situations like a coma even. So the message would be, you should never stop medicine or insulin when you're sick. And also consult a doctor immediately, and he will help you to decide what has to be done.
Doctor, can I do fasting if I have diabetes?
No, fasting may not be a safe thing to do for diabetic patients, and it's always safer to avoid fasting. And there are other forms of penance or worship that people can resort to. For example, giving away alms as a substitute for fasting. So that those things can be thought of, because fasting is a dangerous thing for a diabetic patient, because the blood sugars can fall precipitously, and they can go into a coma even. So generally it is not advocated. So I would never encourage fasting as much as possible.
What is low sugar or hypoglycemia, doctor? What are the symptoms of it? How it can be corrected?
The most important thing is hypoglycemia awareness. Means that you must understand what hypoglycemia is, what these symptoms are, and who is at risk for hypoglycemia. For example, people taking insulin is at very high risk for hypoglycemia. Elderly people are at very high risk for hypoglycemia. Very small children are at risk of hypoglycemia. So it's the understanding that helps us to prevent hypoglycemia. And also in Silverline Hospital, we have our diabetes nurse educator who educates every single patient about the fallout or the symptoms of hypoglycemia and how it manifests, how to correct it, how to recognize it, and what are the ways in which you can glide over or try and overcome these problems. What I'm trying to say is that there are small tips that we can give the patient to help them prevent a hypoglycemic attack. Like for example, snack often. When you eat smaller meals, but spread your meals over time. Then the timing of the insulin, the timing of oral glycemic agents, so many of these things. And then some of our patients who are at high risk are given glucose tablets to keep in their pocket. So the immediate and they are educated to open the packing immediately, pop it into their mouth, keep it there, suck at it or chew at it. And this will correct a hypoglycemic attack. So these are some of the ways in which we can actually help people understand what an attack is, what hypoglycemia is, to recognize it and then to treat it.
Doctor, what causes diabetes?
There's very little anyone can do about it. If you and your wife have diabetes, there is a very high chance that your children will have diabetes as well. But there's very little we can do anything to prevent children from becoming diabetic. But one thing is for certain, leading a healthy lifestyle, maintaining a healthy weight will to some extent keep diabetes at bay. And that's something that is within our power to do to prevent children from developing diabetes. But even that may not completely null the effect of the fact that these children have very strong genetic predisposition to develop diabetes. So yeah, I think exercise, maintaining good weight, trying to live a stress-free life is what the best insulation would be. Management of diabetes is always engaging the doctor more. So the more you engage the doctor and his team, the more healthier you are. And also, the doctor is not alone in this pursuit. The doctor is fully backed up by an able team, as I said, comprising of nutritionist, diabetes nurse educator, the podiatry nurse, there are a psychologist, a dentist. All these people put together form an effective team in the management of diabetes, and that is what we have in Silverline. And I would want my patients to come and make best use of this facility that Silverline has to offer. Thank you.
Doctor, thank you very much for explaining about diabetes.